Welcome back to The Price of Business. I'm your host, Kevin Price, talking to you about you and your business. We got Geetinder Goyal on the program. He's a regular on the show. His company, OurWayHealth.com, is his website for his very important healthcare practice. He's part of a healthcare revolution that I consider myself a part of that is so incredibly important in our society today. And we've got an excellent guest who's also a part of that healthcare revolution, and I'm looking forward to our chat with him today. Geetinder Goyal, Dr. Goyal, why don't you tell us a little bit about Our Way Health and then introduce us to your guest today?
Yes, Our Way Health. Good morning, everyone. Good morning, Kevin. Welcome, Jay. Our Way Health is a direct primary care practice, and what we're trying to do is we believe that everybody needs to have access to a quality primary care physician. And so through Our Way Health, we are trying to bring concierge-like primary care services to common man, that it shouldn't be just for people who have, money or are wealthy. Everybody should have access to quality primary care, and that's what we're trying to do through Our Way Health. And like you said, our guest is part of this revolution, and he started his own revolution. He's co-founder of Free Market Medical Association that started out of Oklahoma City. And it has grown really rapidly and is going to become a force to reckon with for some of the, I want to say, anti-free movement, anti-free market people in healthcare. Welcome, Jay.
Actually, it's a movement for those who are pro-free market, right?
You bet. Absolutely.
Yeah. And by the way, I get so frustrated. I had a conversation with someone yesterday, about, our upcoming guest being Jay, and that, and what he's for and what I'm for and what Geetinder's for, and about getting rid of these layers of bureaucracy of government and insurance when it comes to our health care to really make it affordable and really make it, restore the relationship between the patient and the doctor. And you know what? I could have had 3 heads on my shoulders when I was talking to that person. They thought it was the weirdest thing they'd ever heard. I'm telling you, we've got a lot of work on our hands, gentlemen.
We do.
Jay, talk about, I guess, the reasons behind starting Free Market, and, when did you guys start it? How old is this organization?
Sure. Thanks, Geetinder. Hello, Kevin. We started the Free Market Medical Association about 2.5 years ago, and it was formed by myself and Dr. Keith Smith, which is the managing director of Surgery Center of Oklahoma. They've kind of been on the forefront of free market healthcare. He was kind of the original pioneer. We really formed it because what we saw was there was a huge need to bring together buyers of healthcare goods and services, which are obviously patients, also self-insured employers, bringing those together with sellers of healthcare goods and services, which would be physicians like Geetinder and hospitals and labs and imaging centers. And right now, the buyers and sellers really are all that's required in the free market. You just need a buyer and a seller. But very rarely in today's healthcare, if you think about the buyer being the self-funded employer or the patient and the seller being the actual provider of the care, very rarely do they view each other as the only two that really belong in the transaction. In fact, they very rarely in today's world ever talk to one another about the purchasing of healthcare goods and services. They very rarely negotiate with each other on the price, the quality, or anything else. It's really kind of crazy the way American healthcare has evolved. There are so many layers between the buyer and the seller that Dr. Smith and I, we kind of discovered it in our own relationship, is once the two of us, myself representing self-funded employers and him running a surgery center, once we started talking across the table with one another, we found out all kinds of interesting layers that were between the two of us, that some of them he wasn't aware of and some of them I wasn't aware of, and we kind of figured out, well, if we could just start doing business directly together between my employers and his surgery center, my goodness, we could cut a tremendous amount of waste out of this transaction and keep the quality high, increase the efficiency, and lower the cost.
Yeah, no question about it. It makes perfect sense. You know, the great economist Thomas Sowell, you know, in his discussion about the Affordable Care Act, he said there's this crazy thought out there that somehow adding the government to costs that already exist will somehow make health care cheaper. You can't add the cost of anything and expect the cost of that thing to not go up. And so, you know, kind of the opposite to that is that if we can get rid of some of these costs, we can make healthcare real world accessible to the vast majority of people out there.
That's absolutely right. You know, a surgery center or a hospital that works directly with the buyer, the employer, and or the patient, you know, they're subject to those same free market forces that the shoe store is having to deal with, and that is, you know, when they make a purchasing decision, a capital expenditure at their facility, if it does not help them take care of their buyer, their customer, better, more efficiently, lower cost, higher quality, then again, the shoe store is punished in the marketplace. Healthcare needs a dose of that.
Dr. Goyal?
You know, I totally agree. You know, the part of the reason that we are in this mess is that we are to blame for it. The buyer and the seller has to sort of take that blame for the mess we are in. And now this is about the Free Market Medical Association and even Our Way Health. Kevin, we are about kind of bringing that dialogue back between the buyers and sellers, so we can start talking about this and you know, removing those layers as Jay talked about. But Jay, it has really become a mission to now educate the masses about this, right?
Yeah, there really is. I mean, that is kind of the FMMA's mission is to explain to the masses that you know, flatter, more efficient healthcare can increase quality and lower cost. But it is a, you know, Geetinder, you and I have talked about this many times in the past, that people do, just like Kevin's experience earlier was, you know, people look at you like you are absolutely crazy when you talk about buying you know, a surgery the same way that you buy a flat screen TV. But if you think about it, in a free market, it is just a good or a service. And you know, the buyer, if they expect to, the seller, if they expect to sell a lot of what they have to sell, they have to be responsive to the buyer. And when you explain healthcare in that way, people just look so puzzled, and it's really kind of the mission of the FMMA is to kind of shed light on what the real solution to healthcare is, just staring us right in the face.
Mm-hmm. Yeah. No question about it. I think it's a very important revolution, very timely, and it's so important. By the way, Jay, the best website for you that you'd like to give on the program?
Yeah, absolutely. The Free Market Medical Association's website is pretty easy to remember. It's just fmma.org.
Yep.
And we do have a conference that is scheduled for August the 18th in Oklahoma City, 18th through the 20th. And then buyers and sellers of healthcare goods and services which basically would take in pretty much the entire country, they're welcome to attend. And then also we would also love to have high value facilitators that help make that transaction between the buyer and seller more efficient. They're also very welcome.
Yeah, yep. I'm hoping to attend myself. I think it's going to be a great event. And Dr. Goyal, you can reach him at ourwayhealth.com, ourwayhealth.com. Dr. Goyal, a final question for our guest.
Jay, we always talk about, and I don't know how much time you're going to have to explain this, but the one of the pillars of free market is pricing is not the product, right? And that basically means that a lot of the bureaucracy or the middleman, what they are doing is they are selling the buyers discounted pricing on healthcare, and they have made that a product, right? And free market really kind of goes towards, selling the actual services of healthcare and not just the price. So that has become kind of one of the bases of free market and what we talk about in the Free Market Medical Association, that pricing is not the product. Talk about that a little bit, please.
Oh, boy. Well, you've just flipped over a big rock there, haven't you? Yeah, that is one of the pillars of the Free Market Medical Association. Pricing is not a product, and most people don't really realize this, but the health insurance industry is, they're not 100% in the risk transfer business anymore. In other words, you're not necessarily just buying insurance when you take out a health insurance policy. The big insurance companies, their negotiations, their leverage, their pricing leverage that they have with some of the larger hospitals and some of the doctors out there, they actually market themselves. One of the reasons why you would do business with XYZ health insurance company is because of their wonderful discounts, their wonderful pricing. And employers have been taught that you should pay a premium. It's actually worth it for you to pay more to an insurance company because they have better discounts than the other guys. And I always find it funny that if the big insurance is so good at negotiating discounts and keeping a handle on pricing, why is pricing uncontrollably increasing year after year after year? And besides that, there's also a cottage industry outside of the insurance companies that will go out there and negotiate on an employer or on a patient's behalf for a whole slew of medical procedures where they make a percentage of the savings that they're able to negotiate. Like I said, this is like a whole nother call, but if you have an industry, and this is a multi-billion-dollar industry that makes a percentage of a negotiation, then you really, if you think about it, if you're in that business of negotiating, you get a percentage of the margin that you're able to negotiate down. It's really easy for you to maximize your profits if the healthcare costs are high to begin with.
Yeah. Gentlemen, I'm sorry we went way over. It was well worth it, though. It's a great topic. Very, very good topic. Jay Kempton, and he is the founder of the Free Market Medical Association. Dr. Geetinder Goyal, he has a practice called Our Way Health. Dr. Goyal, regular contributor on The Price of Business. Gentlemen, great, very robust conversation. Look forward to more of these in 2016. When we come back tomorrow, we're going to have more for you. I do want to remind you my interview with U.S. Senator Rand Paul on Sunday's TV edition on the Biz TV network. Learn more at priceofbusiness.com. Have a great day. Spend it right here.